Hey there, Dr. Charlene here, and I run the Recovery Blueprint. And I want to talk about something that maybe you've come across, maybe you haven't, and I want to point out some upsides and some downsides. And we're going to talk about functional medicine. Now, if this is brand new term to you, then I will give you a quick synopsis. So you're probably familiar with the conventional medicine model. You go to the doctor, you get 3 to 7 minutes with them, and 7 minutes is pretty generous. And they give you a bottle of pills and you go on your way. You typically don't get your questions answered, you don't have time. I know I've been in a situation where she literally had the door open, 1 foot in the room with me, 1 foot out in the hall as I was trying to ask her questions. And if you've been there, you probably were as frustrated as I was. And so that's the conventional medicine model. Now we have this upgraded version called functional medicine. And I have practiced functional medicine for nearly a decade. I thought it was the end-all be-all, the only thing that was going to really work for my patients amongst this kind of weird, woo-woo, ancient Chinese medicine that I learned and love. And so functional medicine, like I said, is an upgrade to conventional medicine, and it really goes into how the body is functioning. So we want optimal function within the body. And like I said, I practiced it for years. I still utilize a lot of the tools in my practice today and in my support group with my patients, my members in my support group. However, it has its limitations. I recently went to a 3-day seminar where I got kind of a refresher on how functional medicine works just in basic blood work, how we're looking at basic blood work, probably a panel that your doctor is going to run every year regularly with you. And I was reminded that it's still reductionist. We're still looking for the one root cause of disease in the body. And what I've come to learn in recent years with my patients and the members in my group is that there's never one root cause. It's a collaboration of root causes. And so getting that reductionist model saying that the only thing somebody needs is vitamin D, then they try the vitamin D and that wasn't the silver bullet that solved their problem. So I've found there are big limitations with functional medicine. One, it's still kind of that reductionist concept like conventional medicine is trying to do. Have they referred you to an endocrinologist, a gastroenterologist, a cardiologist, and all of the ologists out there, and you have like 17 doctors and nobody's looking at you as one whole human being? Functional medicine is upgraded where they're looking at a lot more systems, but they're still looking for that one thing that's off or one root cause. And so in recent years, I've gone back to my roots. I have started practicing and leaning into the beauty of the ancient Chinese medicine that I learned years ago. And I've found with modern science and all of this great technology that we have, that a lot of these herbal medicines they at least contain a lot of the constituents that we're extracting out for our supplements in functional medicine, but they're unifying the whole plant. It's working synergistically together. And so I've found that in leaning on the roots of the beautiful medicine that I practice, actually we're solving more problems more effectively, more quickly than functional medicine alone. It's still important to get your blood work done and take a look and see what's going on in the body, and that's a really great measure of how you're improving, but it's not the end-all be-all. So I like to joke that ancient Chinese medicine is greater than functional medicine, which is greater than conventional medicine. So if you've been seeing a functional doc and you're not getting the results that you would have hoped for, then let me know. I might have a better solution out there. Again, I'm Dr. Charlene with the Recovery Blueprint. And if you're interested in working with me, I have a free support group and the link is below the video. Thank you so much. Be well.